Welcome to Special Smiles Dental Clinic. A special smile for a special someone.
Chinito! Chinito! Come. Every morning I have to do this with you. I need to get your teeth brushed right now because I need to make my salad before my Zoom meeting. Let's get this day started. Come.
This is a frustrated mother, one who has exceeded all her possible options just to get her special needs daughter teeth brushed in the mornings.
Come on.
As you can see, the mother is shouting, the child is crying. This mother is frustrated and so too is the child. The mother finally decides out of frustration to take her daughter to the dentist.
Good morning, Mommy. Good morning, Samantha. How is everybody doing today? Everybody's looking bright and chirpy this morning. So I'm having an issue with her. She doesn't want to open in the mornings to get her teeth brushed. And she's getting a lot of cavities and I'm tired of it. I don't know what to do. Alright, well I'm really happy that you brought her in today, It's really important that as a special needs patient, you come in for your regular checkup. I'm glad that you found it important to take her in because usually they're at higher risk than everybody else. Probably due to the medications, as you said, ability to open the mouth and all of that to brush your teeth. So they have a higher risk of developing caries and other oral health issues. So I'm really glad that you saw it important to take her in today. But that's fine. It's okay, we'll take care of everything today, okay, Samantha? You have nothing to worry about, alright?
Before we get further into the video, we'd like to make note of who a special needs patient is. These patients are individuals whose medical, physical, psychological, cognitive, or social situations make it necessary to consider a wide range of assessment and care options in order to provide dental treatment. These individuals include, but are not limited to, people with developmental disabilities, cognitive impairment, complex medical problems, significant physical limitations, and vulnerable elderly.
Dental visits with a special needs patient. Before the visit, if it's possible, try to sensitize the patient as it relates to what to expect so that this can build their excitement and their understanding about the visit. A book I would suggest for toddlers is Freddy Visits the Dentist. As it relates to older patients, it might be good if you can take them into the dental office before the visit so as to help to familiarize them with the setting. Some behavior management strategies you can expect to observe are the creation of a caring, empathetic, relaxed environment, positive reinforcement, distraction using television, games, or music, voice control, the tell, show, do, immobilization with protective devices and restraints, sedation, or even general anesthesia. The patient may tend to show signs of fussiness or fright and may not want to stay still, but that's okay. It's normal. Just to be patient. You may need to sit in the dental chair and hold the patient during the checkup. When talking, whether to the patient or to the dentist, only say positive things. Refrain from using words like hurt, pain, scared, shot, needle, or drill. Expect the patient to be anxious and fearful. It's possible that their behavior may interfere with the safe provision of dental treatment. In such instances, physical restraints can be appropriately applied, whether using physical, such as holding the body parts to control movements, mechanical, such as the use of papoose boards or mouth props, or chemical, sedation. For the most uncooperative patients, general anesthesia is often the most ideal method, so expect to give consent.
Just get to know each other a little bit, right? Okay, what's your favorite color? Pink. You think you love pink? That's nice because guess what? I have a pink candy rope here for you today. Alright? Nothing to be afraid of. I'm just gonna rest it here. What's your favorite cartoon, Samantha? Peppa Pig. You love Peppa Pig and Peppa Pig is also pink. notebook at home?
No.
Alright, I'm going to make sure I get a copy of the Freddy Visit to Dentist book for you so mommy can read it to you next time, alright?
Yay.
Okay, Samantha, today we're not going to be doing much. I'm just going to show you all the things I use to get rid of all the sugar bugs in the mouth next time when you come to see me, alright?
Can I see your beautiful face?
You want to see my beautiful face? Sure. Am I beautiful?
Yes.
Can I see your beautiful face? I know you're way more beautiful than I am. Aww, so beautiful, Samantha. Alright, let's get started, alright? So, I will be using this tooth shower. This is the tooth shower.
Nice.
Nice. You can see? So the water running, that's the tooth shower. Right? I'll also be using the tooth wind. Can you hear the wind? Feel it.
It's cold.
Yes, that's the tooth wind. Okay, Samantha, so with the tooth shower and the tooth wind, I'll also use the tooth mirror. You see, can you see a beautiful face? So we'll use a tooth mirror. We'll use our tooth scrapers and our toothbrush to just get rid of all the sugar bugs inside the mouth so we can have a special smile, right? You want to have a special smile? Yes, special smile for a special person.
Keeping the smile and dentition safe. For a special needs child, extra precautions are taken to prevent dental injuries inside and outside the home. Injuries to the head, face, and mouth are common, especially among children. Learn how to prevent these injuries and handle them if they occur. Special needs child should also visit the dentist for regular checkups. Inside the home, safety locks should be placed on cabinets so that they don't drink or swallow harmful products like bleach or pills. All cords should be kept out of reach. Safety gates should be placed at the top and bottom of stairs. Monitor the child when they're eating or playing. Tell child not to put things in their mouths. And don't place the child in high seats when they're eating because they can fall and hurt themselves. At school, provide the school with the emergency phone number of your child's dentist. Teach your child to hold the handrail when walking up and down stairs. Have your child wear a helmet when riding his bicycle or playing contact sports like football. Teach your child not to bite or chew on hard objects such as pencils. Check out the play equipment at school to ensure that it is in good condition and surrounded by a soft material. Inside a moving vehicle, an appropriate car seat or booster seat should be used in the back seat at all times. Do not allow children to place objects in their mouths while riding in the car. With toys, follow the age recommendations when selecting toys. Ensure that the toy is too large to fit in a child's mouth. Ensure that they don't have small parts that can come off and be put in the mouth. Ensure that they aren't sharp and that they are made of soft material. When playing outside with bats or balls, carefully supervise the child. For dental emergencies, for a toothache, the child needs to see a dentist as soon as possible. Do not use heat or place aspirin on the aching tooth or gums. If a tooth is knocked out, it can be saved. Find the tooth, place the tooth in a glass of milk or in the child's saliva. Take the child and the tooth to the dentist immediately. And for a permanent tooth, rinse gently with warm water and place it back in the socket. If a tooth is broken, gently clean the injured tooth with warm water. Place cold compresses on the face in the area of the injured tooth to minimize swelling, then make an appointment with the dentist. For a bitten lip or tongue, apply direct pressure to the bleeding area with a clean cloth. If swelling is present, apply cold compresses. But if bleeding continues and does not decrease within a reasonable amount of time, go to the hospital emergency room.
As it relates to nutrition and oral health, there are a few things to note. Eating healthy is especially important for the special needs patient as they are more susceptible to oral health related issues. They should maintain a diet that is high in fruits, vegetables, and calcium, and sugary snacks should be kept to a minimum as Sugar-containing foods may lead to increased risk of caries. High soft drinks and fruit juices should also be avoided. However, if they cannot be avoided, they should follow with a glass of water. Usually our special needs patients are unable to open their mouths, and if you have Down syndrome, you tend to have difficulties chewing and swallowing, and people on the spectrum may also have aversions to certain textures and flavors. Parents usually use sweet foods for behavior modifications and reward, but this is contraindicated and discouraged because this may lead to an increased risk of carious lesions. A special needs patient may face specific barriers to having a healthy relationship with food, and if a child refuses to eat items outside of a pre-approved food list, it's important that a good supplement is provided. Many parents simply report that just getting their child to eat is a big achievement, and this should be taken on a step-by-step basis. Certain medications tend to affect the special needs patient and the amount of vitamin and mineral absorption that they can take in the body, and this might have oral cavity effects on the patient. In the case where Ritalin decreases your appetite and also causes dry mouth, which may lead to carious lesions. Risperdal, which is an anti-anxiety medication, may lead to an increased appetite, which might spike sugar intake and therefore lead to obesity. And steroids tend to suppress the immune system and lead to oral thrush and mouth sores. So a decreased consumption of foods might also result in malnutrition because they have the mouth sores, so they would not eat as much.
Oral hygiene instructions. Caring for the teeth. For caregivers or parents, to prevent dental problems and maintain good oral health, it is always wise to follow the BFV, and this is to brush twice a day, floss once a day, and visit the dentist regularly. As it regards to infants or toddlers, for infants without teeth, use a clean, damp or wet cloth to gently wipe the child's gums, tongue, inside the cheeks and outside the lips. Attempt to do this at least twice per day. Once teeth begin to arrive, begin using a child-sized soft bristle toothbrush with water to clean teeth and tongue. Consult with your dentist or pediatrician to see if fluoride needs to be added to your child's diet. If so, a fluoridated children's toothpaste should be used to brush the teeth and tongue. Choose a time in which the infant or toddler is not flustered or tired, such as after feeding. Always try to cradle the head with one arm while the other is used to brush or wipe the teeth. Toothbrushing or cleaning should be done in a well-lit room once the child is comfortable. Try to sing, talk, or smile with your infant during cleaning, and allow the infant to hold the toothbrush once they can do so. Allow your infant or toddler to watch you brush your teeth. You may even practice tell show do. A smile check should be done once a month, which involves lifting the child's upper lip and pulling the lower to examine the teeth and gums. Try to examine all surfaces or sides of the teeth, especially when those at the back are present. Never share toothbrush with your toddler or infant. Do not place pacifiers in your mouth, then into the child's mouth, since this may cause transfer of bacteria from your mouth, resulting in caries. In regards to child, adolescents, and adults, the same concept applies. Teeth should be brushed twice a day, should be flossed every day, and the dentist should be visited regularly. Ensure the toothbrushing and flossing are supervised daily. Allow gradual change or adjustment to toothbrushes and the technique of brushing and flossing. This can also be done by use of tell show do. Use your voice and body to communicate positive feedback and reinforcement. Try to implement a routine for dental care by using the same technique at the same time and place daily. Try to be creative by playing their favorite music during brushing, singing a song intermittently, or allowing them to hold a toy.
How to make toothbrushing fun. Allow the child to choose a variety of his or her favorite toothbrushes from the store. Then you allow the child to choose his or her favorite toothbrush of choice when you're about to start brushing. Remind them to never swallow the toothpaste after finished brushing. Allow them to brush their teeth once they are able to. Develop a toothbrushing routine and make it interactive and fun. How can one make holding a toothbrush easier for a special needs child? Now, there are several modifications that could be employed in this situation. The first modification that will be discussed is the tennis ball. What you want to do is get a tennis ball, cut a hole on both ends of the tennis ball and push the toothbrush through it. Another modification is the bicycle handle. You want to get a bicycle handle that is small enough to fit the size of a toothbrush. Push the toothbrush into the hole where the bicycle handle would normally fit. Another method is the use of an elastic band or a piece of Velcro. This is used to hold the toothbrush in the child's hand, but be careful not to pull the elastic band or the Velcro too tight.
Special conditions and oral health, autism and oral care, strategies for care. Fluoride, sealants, and antimicrobial agents are recommended treatment options. Create a routine for their daily oral hygiene. Sensitize the individual to the dentist or dental clinic. Ensure that the child drinks water often. Cerebral palsy and oral care. Toothbrushing and medications. Establish a routine for taking care of their teeth. Have the child seated during toothbrushing to prevent gagging or difficulty breathing. If there is trouble spitting, use a clean, wet towel to remove the toothpaste. Give water and wipe their mouth after taking medication. Down syndrome and oral care. Effective oral care strategies. Maintain a routine for brushing and flossing. Use sugar-free medicines if available. Use tell, show, do to encourage independent brushing and flossing.
Oral care for the visually impaired. Use musical jingles or audio tapes to teach persons with visual impairment, since they depend much more on noise, speech, and touch for proper orientation. Use a floss holder to make flossing easier. The tactile sensation can be used for the placement of the floss in the correct position. Use instructional aids such as Braille and bold scripts to provide dental health instructions for the individual. Positive reinforcement can be used to improve the individual's oral health status. ADHD and oral care. Expect that persons with ADHD will have significantly increased incidence in behavior management problems when trying to achieve oral health care. Give only one instruction at a time and make them clear and short. Consider small rewards for appropriate behaviors. Use positive reinforcement to obtain compliance.
Okay, mommy, so just before you go, I just want to have a little talk with you, alright? Alright, so for the next visit, although she came in today and we familiarized her with the setting, I want you to expect that it is possible for her to still be anxious and fearful, but that's fine. We're just going to be patient with her so we can get everything done. In the meantime, I want you to choose to give her less sugary foods, alright? Going forward, try to brush twice daily, floss at least once per day, and we're going to continue with our regular dentist visits. Try to make toothbrushing, fun for her. Let it be interactive. Develop a routine and try to get her to involve into the toothbrushing process, alright?
Thank you, Dr. I really appreciate it. And I'll see you in my next visit.
Okay, no problem. Thank you for taking Samantha in today. Samantha, thank you for coming and being so cooperative. I have a little gift for you that you're going to use to get beautiful smiles until I see your beautiful face again, alright? This is yours in your favorite color bag. Don't share it with anybody, only yours, alright? Nice. Thank you for coming today, Samantha. Thank you for coming, mommy. See you guys next week. Bye.
Good morning, Chin Chin. This morning we're going to be brushing the teeth, alright? Remember what the dentist said yesterday? Alright, we're going to keep the special smile alive. Now we're going to play our little song, right? Alright, let's go. Sparkle, sparkle, little teeth, some above and some beneath. Brush them all at every meal. Clean and fresh they will feel. Sparkle, sparkle, little teeth. Some above and some beneath.